Good afternoon, everyone, and thanks for joining us today. In the Legislative Building in Regina, we have Deputy Premier and Minister of Education, Gord Wyant, and Chief Medical Health Officer, Dr. Saqib Shahab. We don't have any officials joining us over the line today, so if there are any questions for officials or for the SHA, we will note them and take follow-ups. Deputy Premier Wyant will have an opening statement, as will Dr. Shahab, then we'll have time for questions.
Good. Well, good afternoon, everyone. Thanks for joining us today. Last week, we announced that our schools will reopen this fall and that classes will begin as early as September 1st, depending on the local school division calendars. Today, under the direction of Saskatchewan's Chief Medical Health Officer and with the help of our response planning team, we are releasing the primary and secondary educational institution guidelines for returning to classroom learning. As the Minister of Education, I can assure you that our government values the education of every child in this province. Their safety and their well-being, as well as that of our educators and school staff, is paramount as we plan for their return to school this fall. These guidelines will ensure that we are protecting our students, our school staff, and our families while also providing quality education to the future leaders of this great province. The precautionary measures within these guidelines will be implemented to reduce risk and include standards for cleaning and sanitation, along with measures for general operations, facilities, transportation, and programming. We will ask that parents and caregivers please monitor their children for any signs of or symptoms of illness. If your child is feeling sick at all, they should stay home. We've also requested that schools increase sanitation measures and continue to promote proper hygiene practices. This includes the availability of hand sanitizers and washing stations, establishing protocols for limiting shared materials and equipment, such as backpacks and school supplies in and out of the schools, and planning for minimized contact among students and staff as much as possible. For younger children, we know maintaining physical distance is less practical, and the focus should be on minimizing physical contact instead. All of our kids have had to learn about physical distancing over these last number of weeks, and we know this has been challenging for them and for their parents. These guidelines reinforce minimizing that physical contact while maintaining a school atmosphere that's normal and as comfortable as possible. This may mean playing shadow tag or giving air high fives during recess. These guidelines will also help to ensure that the operators of provincial pre-K to grade 12 schools can plan to resume as previously scheduled this fall. We are putting these guidelines out well in advance of the start of the school year so school divisions and teachers have ample time to prepare. We are open to any input from school divisions and teachers and may tweak these guidelines between now and the start of the school year as we work with our educational partners. As we move through this global pandemic, our top priority continues to be the health and the well-being of our children and our communities. And I can assure you that the Ministry of Education, the Response Planning Team, and the Chief Medical Health Officer are working diligently to ensure that the return to classroom this fall will occur in a safe yet comfortable environment for both students and school staff. We will continue to monitor the pandemic situation and, of course, to follow the advice and recommendations of this province's Chief Medical Health Officer. To the parents, the caregivers, teachers, and staff, thank you for your patience and your exceptional guidance to our children during these extraordinary times. And to our students, thank you for being so resilient during this time. We know it's been hard not to see your friends, staying away from the playgrounds, having your classroom at the kitchen table. We all know that Mom and Dad aren't as cool as your regular teacher. So we're so excited that this summer you'll be able to play, splash at the spray parks, and hang out at the Ball Diamond. Have a wonderful summer. We can't wait to see you this fall.
Thank you. So thank you, and I'll just like to reconfirm that the guidelines that are being posted today regarding school reopening are based on the best expert evidence, as well as based on the experience by many jurisdictions throughout the world who have reopened schools during the COVID-19 pandemic. And so they really reinforce the fact that the risk is low for school children, and the way the guidelines are laid out will enable a more or less normal resumption of school with some extra attention like Mr. Wyant mentioned, to hand washing, to obviously not going to school if you're sick, which we say every year during flu season anyways, and some limited cautions around having large assemblies and other large events, but hopefully not just classes, but also other extracurricular activities. Sports will continue in the school year, and obviously over the summer we'll again get more confident as summer recreational sports start outdoors next week and indoors a bit later. So I think we need to be reassured that the best evidence does support these guidelines. And again, I would encourage all parents, as well as obviously all teachers and others who work in the school system, to really read through the guidelines and be comfortable with what they say. And if there's any questions, again, that feedback is welcome. And certainly in the school year also, both public health and the school systems will be supporting parents and children as school starts. In terms of ongoing discussions and questions we get about gathering sizes, a lot of interest in having a number of events, both large and small. So again, reinforcing that starting Monday, the limit for indoor and outdoor gatherings is 30. But all the principles and cautions apply around 2-meter distancing unless you're part of a virtual household, which is capped at 15, and also cautions around serving food and suggestions about in the guidance that's online about how to make that as enjoyable and low risk as possible. And for larger special events like graduations, worship services, other celebrations like weddings, or when we have to grieve, such as in funerals, there are specific additional precautions about limiting groups to 30, and if additional groups of 30 have to be there, significant spacing, and all those measures reinforce that we have to minimize risk of ongoing transmission. And finally, I'll just quickly walk over case numbers. So we have seen an increase today of 15 new cases, 1 from the far north, and 14 linked to the south region. So central and south parts of Saskatchewan historically had very few outbreak cases, but these 14 cases are actually linked to an outbreak, so they're not sporadic pop-up cases over a large geography. They're linked to a specific outbreak in the Maple Creek area and 2 Hutterite communities. And it's part of a much larger investigation that Dr. David Torr, who's the local medical health officer, is engaging with the Hutterite Safety Council and the leadership of those colonies, because it involves several colonies both in Saskatchewan and Alberta, because there's frequent travel back and forth. So this is part of an ongoing outbreak investigation, and details as appropriate will be shared. But this again is an opportunity for all of us to realize that although our numbers have been low, COVID-19 can pop up anywhere, but it can be managed by physical distancing. And if a case comes up, and even if there's an outbreak, through appropriate testing, case contact tracing, and follow-up, we can get over it. I think we saw how it is controlled very successfully in very challenging situations in La Loche and Northwest Saskatchewan. We hope the same principles will apply in the Southwest, and we'll be able to control this fairly quickly with support of local leadership, as well as public health and the SHA staff who are supporting clinical testing, and if required, hospitalization. At this point, we're not aware of any hospitalizations from this outbreak. And then, of course, for people living in the Southwest, in the Maple Creek area, obviously, if there's any questions or concerns, testing should be easily accessible, and there's information about symptoms, about other cautions, and really not just in the Maple Creek area, but everywhere. We need to continue practicing what we have been saying for the last little while, moving into the future, maintaining that 2-meter separation from people who are not in a virtual household, at work, when we're out and about shopping, or when we're meeting each other socially, maintaining that 2-meter separation, and all the other precautions we need to practice as we reopen in Saskatchewan. Thank you.
Thank you, Doctor. We'll take our first question from the room. Adam?
Sure. Minister Wyant, and for the doctor, what are the criteria for shutting a school down this fall? Will it have to be, a number of cases, school by school, city, community? How are you going to determine that?
Perhaps I'll let Dr. Shahab answer that.
Yeah. So we've had really good experience with influenza outbreaks in the past. And obviously in the past, schools sometimes get other outbreaks like norovirus or other communicable diseases. So medical health officers have a long experience and public health nurses have a long experience of working closely with schools and school divisions. That relationship already is continuing with preparing for school reopening in the fall. What we have seen from other jurisdictions is, so first of all, with COVID-19, we already know that children, for the most part, either don't get sick at all, and that's what our data has shown, that's what data nationally and internationally has shown. And even if they do get COVID-19, the symptoms are mild. So the first principle, of course, is stay home or keep your child home if your child is unwell. And I have to reinforce that with daycares continuing to be open throughout, we haven't had issues in daycares. So I think that really supports that we can start school safely. If there was a child who was unwell in school, there's instructions for isolating the child safely from other children, even within the class with a 2-meter separation, and then the child can go home. It could be a common cold or a cough, or it could be COVID-19, and the child may need to be tested as appropriate, but that should not be a reason for panic. Even if there were 2 or 3 children in a class, or there was an outbreak within the school, I don't think that necessarily means that the school needs to shut down again. I think it just means that there needs to be enhanced attention to hand washing, maybe other measures just to slow transmission down. And similarly, if a school is in a setting or a community where there's an outbreak happening there, that automatically doesn't mean that the school needs to close down, but it just needs some extra cautions, maybe around in the community setting, around exposures to people who are at high risk. Because school children generally are not at high risk, and staff again can protect themselves. Staff, for example, in a school setting may be at high risk in a community when there's an outbreak from other settings like shopping and other things. So the same principles would apply in the community setting, and I don't think the emphasis would necessarily be that the school needs to close down. And I think that's really important to recognize, because many expert reports have actually emphasized that while in March, April, it is important to slow everything down, but schools for the most part are an area where the risk seems to be low, as seen in jurisdictions in Canada and Europe and Southeast Asia that have reopened schools. And even when they've seen a second wave, it doesn't really seem to be an issue in the school setting.
Follow-up, Adam, for Minister Wyant, is there any plan to get split class sizes, bring in extra staff to encourage physical distancing, or do you anticipate that what we saw before the shutdown will be the new normal, the exception of the things that are being put in place as far as the guidelines go?
Well, as Dr. Shahab has said, and I mentioned in my opening comments, we expect school, or expectation is that school will be as close to normal, subject to the protocols that we're putting in place today when it comes to the fall. And again, those protocols can be tweaked depending on the circumstances. So we're not expecting any changes. We are going to be encouraging physical distancing within the schools to the extent that that's possible. And so that, from my perspective, I don't think you're going to see any material changes with respect to those numbers. I will say that we do have a committee that's working on the class size and the compensation piece in conjunction with the ministry and the STF and the and the SSBA, and so we're looking for some that work to be done. But at least in terms of this fall, I don't think you'll see a lot of that happening within the schools to the extent that it can happen.
We'll take our next question from the phone line.
We have Mark Smith with CTV.
Will there be any additional funding provided to school divisions to help cover the costs that go along with the cleaning and disinfecting of classrooms and school buses and things like that?
Well, as I've said in the past, we're going to be working with school divisions and with the SSBA with regard to what that might look like. We already know that there are a number of school divisions that have saved some significant amounts of money over the last number of months, not providing in-class instruction, and so we're going to want to understand what those numbers are in terms of what additional supports may be required by the government. In the budget that was tabled earlier this week, there is a $200 million contingency in the budget to deal with issues related to COVID-19 as we move forward. So we will be having ongoing conversations with the school divisions who will be having conversations, of course, with their classrooms, their teachers, to see what additional resources might be needed. But again, we want to make sure that we have that conversation in the context of what those costs might be relative to how much money has been saved by those school divisions over the last number of months.
Follow up, Mark?
Yes. In regards to the outbreak on the 2 Hutterite colonies, how has been communicating information to those community members? How's that been going? And are SHA staff going to the colonies to provide testing and that sort of stuff?
Yeah, thank you. So historically, public health nurses and the local medical health officer and physicians and other care providers obviously have had strong connections with all communities in the Southwest, including Hutterite colonies. And as a result of this outbreak, public health and the local medical health officer, Dr. David Rowe, they are actively involved with the community leadership in terms of assessing all members in the colonies for symptoms, and also reaching out to other colonies where there may have been travel or other linkages because of social reasons for visiting or other visits due to work, as well as with colonies across the border. So this is part of an ongoing investigation, and it is important that public health continue to work with those communities to try to get ahead of the outbreak, because we've again seen in many situations that the faster you move to do testing widely when there's an outbreak, to do quick case contact follow-up, the quicker you can get ahead of the outbreak and actually control it and end the outbreak.
We'll take our next question on the phone line.
We have Phil Tank with the Star Phoenix.
Yeah, I'd like to ask another question about the Hutterite outbreak. So the first 2 cases tested positive last week, but the outbreak was only declared yesterday after 14 new cases were diagnosed. Can you explain the lag there, like why it took so long and why all the cases, I guess 4 or 5 days later tested positive on the same day?
Yeah, so I don't have all the information, and as we get more information, we can certainly share that. But usually what we do see is that there's usually an initial case or cases, and the initial cases reported last week may or may not have been the initial cases, but whenever there's initial case or cases, there's always a more active reach out for, that's called the case contact investigation. And then as a result, you may find many contacts, and some of them may actually be symptomatic, then testing is recommended. So I think that's important to recognize that even when there are outbreak investigations in the Northwest, the outbreak investigation results in more cases than you would find otherwise, because we all know that if it's up to individuals to seek testing, usually many people with mild symptoms don't think of testing, so you undercount actual cases. And that's why we say, even when numbers are low anywhere in Saskatchewan, don't assume there's no COVID transmission. You should continue to take your precautions all the time, and that's why we want to encourage testing even if you have mild symptoms or any concerns, and that would be my message to anyone in the Southwest. But when there's active case contact investigation, anyone who may have been in contact and has concerns, or anyone with even mild symptoms that they may think are not even significant, is encouraged to get tested. So that really expands the case numbers very dramatically, and that's fine. That's the whole purpose of case contact investigation and outbreak investigation, that the concern is not that you're finding more cases, the concern is not the increasing numbers. The real role is that you identify anyone who may have been in contact with cases in the last 2 weeks, and going forward you minimize further contacts to stop the generation of further cases, and that's how you get ahead of the curve and control the outbreak.
You have a follow-up, Phil?
Yeah, can you tell me how just generally how wide the contact tracing, like how many people generally it's involved, and whether there's been cooperation with the Alberta government? I mean, I see on the map that there's, a cluster of Hutterite colonies on the Alberta side as well.
Yeah, so we are in close coordination with the Alberta Ministry of Health. So my counterparts are engaged at the provincial level, and then the medical health officers and public health staff are working with their counterparts across the provincial borders. And that happens in any outbreak that involves more than one province. So that is ongoing, and that will continue till this is controlled. But that's really important for whenever there's COVID-19 doesn't respect any borders. So whenever there's concern that this could have resulted in exposures, Because when you do a case card investigation, you say, how many people would you have come in close contact with in the 2 weeks prior to your symptoms? And if people say, well, someone visited from another colony from across the provincial border, or I went to this small event when there could have been other contacts, they're all added to the list who need to be contacted as contacts. And then if anyone is feeling symptomatic or has other concerns, there's no threshold for testing. Anyone can get tested. And that's how the case numbers rise very quickly. But that's not a bad thing. That's actually what you want to do, because then any new case may have additional contacts that are in addition to the ones you've already found. And that is the only way you can get ahead. So that, the 3 pillars: physical distancing all the time, testing, easy and widely available, and quick, extensive case contact investigation. These are the 3 pillars, which is called the offensive strategy to keep our numbers low.
We'll take our next question from the room. Karen?
Dr. Shahab, can you confirm that the source of the outbreak at the Hutterite colonies was a funeral?
I don't have that information, actually. The investigation is just starting, but I don't have any information about where the initial exposures could have happened.
Follow up, Karen?
Yeah, my other question relates to busing of students. I'm curious how you maintain physical distance on a school bus when generally you've got 2 to a seat.
Yeah.
Well, perhaps I'll just open, you can further comment on it. What we've done is we're going to be putting in a plan for so that we'll be able to do contact tracing for kids who are on buses. There will be a seating plan that's going to be mandatory for every school bus, so every child will have the same seat on a school bus. But at the present time, there's no plan to restrict the number of children that are on a bus. Certainly family members will sit together, but all children will have an assigned seat on a school bus. It's really comes down to a practical problem with respect to the availability of transportation. We're going to encourage parents to transport their kids to school wherever possible. I think that's an important thing that we want parents to know. So to the extent that that's possible, we'd like to see that happen. But those will be generally the restrictions on school buses.
We'll take our next question from the phone line.
We have Lisa Schick with CGME.
Hi. Is there a plan set for when these regulations might end up being rolled back if the situation for COVID gets better in the province, or are these set in stone for the whole school year?
Well, what I mentioned at the beginning, and I think Dr. Shahab will have a comment on this as well, was that these guidelines are certainly flexible. I mean, things may well change between now and the beginning of the school year, and so we're certainly looking to have some flexibility around them. And as things possibly change the school year, there will be some changes to the regulations at all. So there certainly aren't carved in stone. We want to be as flexible as possible to make sure that we're providing the best educational opportunities for our kids within the parameters of the guidelines that are in place. And so they're certainly going to be flexible, and we will be taking our lead from the very good advice that we received from Dr. Shahab and his colleagues at Public Health.
Follow up, Lisa?
Yes. How much, room is there for principals and teachers to figure out details within this, things like entry procedures or visual cues, or are these things kind of a blanket approach across the whole province?
Well, these are general guidelines that are available to school divisions. We will expect that school divisions will be working with individual schools because all schools are configured a little bit differently, but certainly there will be some standards. We would expect that to the extent that different entry paths to the school can be accommodated for different grade levels, that appropriate signage in the schools for moving children through the schools would be something that would be fairly standard among schools. But certainly the work that's being done on an instructional level by the response planning team and the work that school divisions will do with their individual schools will really determine how schools will be configured. There will be certainly some general guidelines that will be applicable to everyone, but there's certainly some flexibility in all this. But again, the guiding principle here is the safety of kids, and so there's no better people to determine what those safety precautions might look like in any one particular school than the people that are actually delivering the educational services in those schools.
And we'll take our next question from the phone line.
We have Connor O'Donovan with Global.
Hey, I'm just wondering if any
discussions were had about providing some kind of like flexibility to families, say if family's not comfortable returning their child to school, or if a family member gets sick and the child has to self-isolate. Has there been any discussions about trying to incorporate some kind of distance-based learning into the next coming school year?
Well, these will all be things from an instructional perspective that our response planning team will be thinking about, and they're already thinking about it. Certainly, there will be children who are immune compromised. There will be parents that may not be quite comfortable returning their children to school. So we're going to have to we'll have to work on alternative learning plans for a lot of those children. We certainly have learned a lot with respect to distance learning over the last number of months. That will be an option, certainly, for those children. But again, we want to see as many children return to school in the fall as possible. We want this to be as close to a normal school year as possible. And so, but we will need to make some accommodations. There's certainly the case. And again, there will be some immune compromised kids where parents feel uncomfortable. And we're going to have to work with school divisions and schools to make sure that those learning opportunities continue to be provided to those children.
Follow up, Connor?
Yeah, I guess it seems to me like if a staff member were to come down with, with COVID-19, it would sort of have a pretty big ripple effect. Are there any particular precautions that are going to be in place to limit contact between staff members and teachers and students, that kind of thing?
Well, as you'll note in the guidelines, there is certainly an emphasis on attempting to reduce the amount of interpersonal contact between people in schools, and that includes teachers, staff, and students. And so certainly there's an emphasis on that. As Dr. Shahab had said, that's one of the key principles in terms of physical distancing. So attempting to restrict the amount of physical contact and distance is going to be an important aspect. And I think that we'll need to see that in the schools. But again, we want to make sure that to the fullest extent possible, we minimize the impact of children in the schools to the extent that we have the guidelines in place. Did you want to add?
Yeah, I think, what we've learned is that, number one, if there was, for example, a family member who had COVID-19, others in the household would have to isolate for 14 days as contacts. So if that's a child in school or in, someone in university, as Mr. Wyant mentioned, there would be already the capacity to continue learning, because otherwise, you just have to isolate for 2 weeks, not because of anything in the school, but because you are a close contact of someone in the household who was a case, which may occur any time because COVID-19 will continue. So that would be managed. And similarly, if adults in the school, teachers and other staff, I think it's not just in the class, exposure can happen in the community. We all have to be careful in the work setting with maintaining that physical distance from each other with colleagues. So those principles will apply. But if for some reason staff member was ill with COVID-19. Again, same principle apply in terms of case content investigation, self-monitoring of people who are not close contacts. That may include colleagues in the school or children in the class, and beyond, and easier access to testing if there were any concerns. But again, I think this is just one of the things that we already have seen those situations in other essential workplaces, and they've been managed and not necessarily result in large outbreaks. So the expectation is the same principles will apply in the school setting as well.
And we will take our next question on the phone line.
We have Brian Aeneas with CBC.
Hello.
Go ahead, Brian.
Hey, I'm curious as to why it was specifically mentioned that the outbreak involves two Hutterite communities in the RM of Maple Creek. In my discussions with one of those communities, they are very upset that it's very public that this is out there. So I guess, can you tell me why it was specified to Hutterite communities, and how would you respond to their concerns that their privacy is sort of being violated?
Yeah. So certainly, this is always a balance, and as I've said in the past, a single case in any community with a household contact is absolutely no reason to name that community, and that's why there was no announcement a few days ago with a single case. But whenever there's an outbreak, there is a need to be public about that, and there's various reasons for that. In this case, of course, it's not just one community; it's several communities that are being that are involved in a part of an outbreak investigation and involves 2 provinces. So there's many reasons why it's important to be transparent about the fact that this is an outbreak, there's an outbreak investigation, and that really informs people who live in the communities. It informs people in the impacted geography, which in this case is the RM. And of course, it should also reassure people that there's an outbreak investigation that's being managed. But if people have any concerns that may have been exposed for whatever reason, they can easily seek testing. And it's important to seek testing if you have any concerns, because that then further involves the outbreak investigation beyond the case contact investigation that's already happening. But I think this is important to recognize, and that granularity in terms of the geography impacted is important if there's an outbreak, but not when there's a single case.
Follow up, Ryan?
No, I'm good. Thank you very much.
Perfect. Do we have any other questions in the room? That concludes our time for today. Thanks for joining us, everyone.